Well, we live in an age where truth is much stranger than fiction these days. A few days ago, the American Board of Internal Medicine, which is the very same board that is trying to discredit and strip Dr. Peter McCullough of his license, and which is funded in part by the CDC, held a meeting to talk about countering misinformation. I love these types of panels. Part of their mission is how to handle prickly, thorny questions like that doctors might get. Like, hey, doctor, my son just had a heart attack, and oh, by the way, he also just had the vaccine. Any connection there? This is what this panel was about, how to handle prickly questions like that. One of my favorite moments came from when Dr. Vineet Arora admits, well, it's going to be hard for us to combat misinformation because we have not been trustworthy. Watch.
How do you field test some of your messages with specific populations?
I'm happy to go first and then feel free to jump in. We have to acknowledge that we have not been trustworthy. That's just, we have to put that out there. And there are going to be groups that have high distrust of the healthcare system. I watched in a ethics seminar yesterday, very powerful. I rewatched Dr. Susan Moore's call for help while she was hospitalized at a hospital, a Black woman physician. And it was heartbreaking, and she went on to die, and she said, like, this is how Black people die. It was horrific, and we need to come to terms with the fact that we need to do better, and so I think that we have to lead with that acknowledgement, that things have not gone well. And so when I see my patients in the hospital and they are there for diabetic foot amputation, right? Like, what are the things that led to that, And some of them, in the old days, we might say, oh, they were non-compliant. That's not going to fly anymore. Like, that's not, what have we done to fail that patient, right? So that they are there, and this is where we've come. And so I think we need to recognize that we need to earn the trust. And if we lead from that we need to earn the trust, then the answer also is, I have a patient who I would talk to about COVID vaccines all the time. And he's like, I know this is your thing, but, I'll listen, but I'm not going to get vaccinated. And I said, okay, tell me what you want to talk about. And we switched to talk about what he wanted to talk about. And then, interestingly, a lot of my patients who know me well don't have good primary care, so they come in and out a lot, so I meet them. Also a distrustful thing, but they trust me now because they see me a lot. And he said, okay, I know you're here to talk about COVID vaccine. I don't know, I'm here to talk about what you want to talk about. And so I think that's the other thing, is we've got to make space to connect with our patients, and our healthcare system has to help us do that.
So the Daily Clout broke this story, and journalist Aitana Hecht joins me now from Daily Clout to talk all about this. Welcome to the show, Aitana. Good to see you. Thank you for all of your work on these stories. It sounds like there's quite a few conflicts of interest here. Can you unpack this a little bit for us? Who is this? What is this board?
Sure. Well, first of all, thank you for having me on. The American Board of Internal Medicine is supposedly a private organization that certifies internists all over the United States of America. Dr. Peter McCullough, one of the top cardiologists of our day, he has been certified by them since the 90s. And throughout the COVID period, as we know, he's been practicing medicine as opposed to just going along with what the CDC and FDA guidelines were, which, as we all know, were basically do nothing until you can't breathe and then show up at a hospital. Well, Dr. Peter McCullough was notified by this board that because of his practices of COVID and spreading of disinformation, he's going to have his license stripped. So when I spoke to Dr. McCullough a couple weeks ago, I did a little bit of research into this American Board of Internal Medicine. I found this Zoom meeting that they had that somebody managed to send a few clips from me. And it really just is shocking how flippant they are with the concerns of millions of people about the vaccines. And their entire goal of this meeting just seemed to be, how can we push away this, elephant of information that they deem to be misinformation. Now, in terms of the conflicts of interest that you're discussing, so Dr. Arora was the guest speaker for the American Board of Internal Medicine this Zoom meeting. She was the guest speaker along with two of her students to discuss an initiative that they're running at the University of Chicago to teach medical students how to give over what they term medical information as opposed to medical and to counter misinformation. So she was the guest speaker. She is listed on the American Board of Internal Medicine Board of Members, yet that was not disclosed in this session. Oh. And in this session, she's discussing taking money from the CDC for this initiative that she's running. So she's taking money from the CDC. And thanking them for it publicly in this board, American Board of Internal Medicine meeting. She sits on the board of members in the ABIM, but doesn't disclose that. And the ABIM on their own Twitter feed says we're a non-governmental organization, yet they're colluding with people who are taking money from the CDC. Now, Dr. McCullough points out that they found out that the CDC began a contract with Weber Shandwick, which is the PR company that has been working with Pfizer and Moderna for decades. Senator Ron Johnson actually wrote a letter to the CDC demanding an explanation for this clear conflict of interest. And the ABIM was presented with Weber Shandwick at a South by Southwest conference last year that Dr. McCullough found out about. So it's just this interconnected web of, I give you this, you give me that, and we'll all pat each other on the back and make each other happy.
One big kumbaya. So I mentioned this at the beginning. I'll play the clip here and I'll get you to talk about it. So listen now as they discuss, my friend has had a heart attack and he just had the vaccine. How do we handle this kind of misinformation? So here it is. Listen.
I heard this and my friend had a heart attack and he just had the vaccine. So then you're like, okay, I now understand where you're coming from. So now let me explain that heart attacks have been happening all the time and this is why this has happened.
What do you make of that?
I mean, it's as though, again, they're not even listening to what people are saying. They're not saying, why are people concerned about vaccines post-heart attack? They're concerned about how do we get people to not be concerned about heart attacks post-vaccine. They take us for fools. In another point of the video, she said something like, we really have to just, use plain language, simplify the language. She kept talking about, in the essence, dumbing down their words for us, the plebes who can't understand anything. Yet their response as a scientific community to heart attacks and vaccines is, oh, well, heart attacks has always happened. So this is why this is happening, in her exact words.
Right. And we played off the beginning that, we have not been trustworthy. Does she elaborate on the lack of trustworthiness? In what way have they not been trustworthy?
Okay, so that was really interesting because when I first heard her say, we have to acknowledge we have not been trustworthy, I sat up in my seat and me and my husband looked at each other and we're like, are they admitting everything? And what she's saying is all connected to a very woke outlook that they're trying to project from the ABIM, from the CDC, in that we haven't been trustworthy with certain communities. Because then if you listen further, the students make a very clear point to say that, well, if you want to give over vaccine information, if you want them to follow our guidelines, then there must be someone who looks like that community speaking to the community. You have to recruit people from within the community to speak to them. So, I thought she's saying we haven't been trustworthy because all this information is coming out that has proven us wrong. But no, they just wanted to pat themselves on the back in terms of acknowledging that they might be racist and how we could be a little less racist in the future somehow.
Here's another clip I want to play where they ask the question, how are we doing with all of this? How are we doing with countering medical myths and disinformation, whatever you want to call it? Here, watch.
But how do you think this misinformation, disinformation, medical myths, whatever you want to call it, how do you think you're doing? How do you think we're doing as a community?
Well, I should start by saying, education is one tool, right? There are many other tools out there. And is this going to be the only tool that battles disinformation? Absolutely not. And we've written about other things that need to happen and social media and policies, et cetera. And I know that Rich Barron and others, at ABIM have as well. And so I would say this is a way to empower clinicians. And what we have seen actually, and this is my shout out to the AAMC and the CDC, which funds our work now, because we started dabbling and then with that early work, answered the call for, grant proposals and schools that are doing this. And we're like, hey, we're doing this. And then take it to a new population. And so with Naomi and Mason, we were like, okay, let's take this to nurses and pharmacists and frontline healthcare workers, because again, that's sort of my identity, which is like, how do we give back to them? And they, at that point, now that it's like further along in the pandemic, the burnout is being perpetuated to the point where at least some, unpublished data that I've seen shows that if you're burned out, you're less likely to counsel about COVID at all, because you're just like, I can't deal with it anymore. And I myself face this, like, when I'm on service, I know seeing the comments that it's hard to talk about vaccines. It's hard to, do the missed opportunity with every hospitalized patient and, build trust. I mean, I'm not even a primary care doctor, but I go in and trying to be as empathic as possible using the techniques that Sarah and others teach us about storytelling and, kind of finding that common ground and asking the why. And I may not get to a yes that day, but maybe in a few months I'll see that I get to a yes. And so the key is to empower our frontline clinicians with the can do better while we also pull other levers, and so with that, I think that at least our experience with working with frontline clinicians these are tools they can operationalize at the point of care. And what's been interesting is that it's not just, so the infographic is a tool, but
right.
sort of it's really the art of reaching people using plain language. And that's something, as somebody who for 10 years taught students research. I mean, my goal was research training, right? I would teach students how to get up and talk to scientific communities, right? And I realized we have never, as a medical schools nationwide or health professional schools, we have never adopted, let's train our clinicians to talk to the public. We talk about, individual patient interactions, but that's going to take a long time. And now as we see people on the radio and TV, newspapers, and so that's what we're really trying to do here with our next rendition is empower students and clinicians to actually take these skills and reach the public. And I know that Naomi and Mason can probably talk a little bit about examples there.
Yeah, I'd love to hear some examples about Canva, how it works.
So how are they doing? Like, it seems like they're really concerned about their, not really with the getting actual information out to people, but really how they're doing managing the public relations around these events.
Yeah, so I agree with you. In my mind, she looked defeated. As you know, that woman, her name is Pamela Browner White. She is she's something to do with this. She's the vice president of communications and the senior equity advisor, meaning she's in charge of equity at the American Board of Internal Medicine. Again, these are the people trying to take away Dr. McCullough's credentials, who is, a scientist and physician they couldn't come close to. But she starts off that conversation by just looking defeated. She says, how are we doing? How are we doing with this misinformation, disinformation, whatever, medical myths, whatever you want to call it? They just have to put all of this into a box because they can't respond to it.
Right. Do you think they are defeated in part because we're now seeing a lot more of this information available on social media? I mean, obviously, we've seen with the Twitter files, we've seen with Elon Musk sort of opening the floodgates. You're seeing the rise of platforms like Rumble, where we broadcast nightly. So this information is now getting out to people, and people are sharing this information. Do you think that that's troubling to them?
Oh, without a doubt. I mean, I can't even, you look, the truth always finds its way out there, but Elon Musk opening the floodgates of Twitter, whether to trust him, not trust him, we'll see, right? But right now what he's done is so important, and he's opened up a conversation that's been stifled for so long. And you can see the relief in these conversations, in these Twitter spaces people are having, in these panels, that all of a sudden it's like people are woke up from the dead, and we have all of these leaders of the freedom movement with a voice where everybody else is having a voice also. And if the people who were pushing this vaccine were so confident in their position, I think we'd see a lot more debate on Twitter Spaces than we are now, because our side is, we want to talk about it all day long. We feel like we have had information for, years now that's been suppressed, that we've been just talking to amongst ourselves. We want to talk about this with other people. And yet you're not really seeing the professionals of the levels of Dr. Malone, of Dr. McCullough, of Dr. Corey, of any of those doctors step up to this conversation. So I think they are getting scared that this conversation is rushing out into the sunlight.
And you spoke about Dr. Peter McCullough. I'll get you out of here on that question, which is speaking with him.
Sure.
Obviously, he's a friend of the show, and I believe his credentials are impeachable. And what does he say about them trying to discredit him and take away his license? Is he keeping quiet about it? Is he concerned about it? What is he saying?
No. I mean, he has a Substack called Courageous Discourse, which is it's where he puts all of his information, anything that he wants to get out there, and he talks about it a lot. If I could just say one more thing before we go about information and misinformation, is that okay?
Oh, please.
The hypocrisy of this board sitting around and discussing how to speak to us about information, medical information, misinformation, is just beyond. I'm not sure if your audience is aware, but Dr. Naomi Wolf, she created Daily Clout, where I work, and Steve Bannon of the War Room. When the Pfizer documents that were attempted to be hidden for 75 years, when they were released by a judge in the beginning of 2022, Dr. Wolf and Steve Bannon put out a call for volunteers to go through this information and go through the Pfizer documents. And they spent, I think it's a miraculous feat, a miraculous endeavor that really shows what citizens can do when they just work together and use integrity. So they found, now we're up to 53 reports of egregious behavior by Pfizer, proving that Pfizer knew the harms of all of this, proving that the miscarriage and fetal rates in the trials were sky high and it should never have gotten off the ground to begin with. And the Daily Cloud actually just published the first volume of the first 50 reports online. And it's within the last week, we very quickly rose into the top 10 on nonfiction bestsellers on Amazon. If we stay there, the mainstream media will have to acknowledge that we are there, at least. And I just think that this, on top of Twitter, on top of everything, on top of this conversation opening, is just, there's no turning back. And the calls to stop the vaccine are just continuing to grow. And we see England just halted the vaccine for under 50s, while at the same time, the VRBAC committee here in the United States is attempting to discuss how they can create this into an annual thing.
Right. Yeah. How can we make sure that it's part of the children's inoculation schedule, that it's an annual booster, that it's just like getting just the flu. Just don't even think about it. Don't even count the number of vaccines you're getting, as Dr. Peter Hotez says. Forget the number. Just go out and get it. Keep getting these in your arm over and over and over again. You're right. And you think about the work of Dr. Asim Mayorta, and you have brave people, of course, in Parliament, like Andrew Bridgen, who's standing up saying enough is enough, get these off the shelves. Information is power, and the work that you're doing at the Daily Clout is fantastic. I will link that up in the description. I encourage everyone to read it. But also, everyone watching right now, like, you have a duty as well. Like, please share this out. Please take this video, share it with a loved one, share it with a family member who's thinking about going out and getting a booster shot, or just share it with your community, because that information is power. Hopefully we can wake more people up with this information. Final thoughts?
Absolutely. Final thoughts are, thank you for what you're doing. I really appreciate your show. I've been a fan for a while. And we just got to keep pushing forward. 2023 has got to be the year that this truth comes out and people approach health in a different manner, rather than just looking to the overlords and what they tell us is true.
Hallelujah. Itana Hecht, we appreciate you joining us. And we'll link this up.
Thank you so much for having me.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.